and welcome to the podcast series Proctology and Laparoscopic Surgery. This is Dr. Manas Ranjan Tripathy again, the laparoscopic surgeon and proctologist with you. Today we are going to discuss what piles or hemorrhoids are, what are the causes and how we can prevent that from happening, and if at all we have it, what to do. So what is piles or hemorrhoids? All of us have hemorrhoidal tissue. Their job is to protect our anal sphincter muscles, the ones that open and close your anus, and help keep our anus closed when you have moments of increased abdominal pressure, like when you are coughing. They become problematic when they start to descend downwards and become inflamed. Then the condition is called hemorrhoids or piles. As mentioned before, your anal sphincter is cushioned by hemorrhoidal tissues or anal cushions. They themselves are made up of what are known as modified squamous epithelium. These highly vascular cushions reside along the anal canal in three main areas: the left, the right, and the back of the anal canal. They are made up of elastic connective tissue and smooth muscles. Many of them do not contain muscular walls like arteries and veins do. Because of this, they are technically known as sinusoids, or a small blood vessel like a capillary, and they can swell up due to blood not being able to leave. When you are relaxed, they provide about 15 to 20% of the pressure, keeping your anal canal closed. When you have an increase in abdominal pressure, like while sneezing, the blood going back to your heart through your inferior vena cava is reduced. This causes these vascular cushions to swell up with blood pushing on your sphincter and thus help prevent the infamous anal leakage. It also thought that hemorrhoids are responsible for helping us determine the exact content of what is coming out, like gas versus a solid bowel movement. When the hemorrhoidal tissue begin to swell up chronically, start prolapsing or inflame, they begin to cause problems. This condition is called hemorrhoids or piles. Once they are piles, they can cause symptoms like hard lumps, which can be painful and itchy. The feeling like you still have to go to the bathroom after you have already gone, and mucus discharge or blight-led blood while defecating. Anything that causes increase in your intra-abdominal pressure can cause hemorrhoids to become prolapsed or chronically inflamed. Thus, there are risk factors for piles like pregnancy, chronic constipation, straining at stools, lifting heavy weights, straining while passing stool, being obese, and increasing age. Some studies have even suggested the tendency to develop piles is inherited. Usually, there are two types of piles, internal and external. A line known as a dentate line is what differentiates them. Located below the dentate line is the external piles. These are covered by a type of skin called anoderm that contain nerve fibers, specifically fibers connected to the pudendal nerves. The cause of the itchy pain is thus revealed. Internal hemorrhoids are broken down into four classifications. First degree hemorrhoids, which protrude only into the anal canal. Second degree protrude outside the anal canal but go back spontaneously. Third degree require you to push them back manually. And fourth degree don't go back into your anal canal even after pushing. The treatment of piles depends on the severity. If only minor, doctors usually choose to simply treat the symptoms, administering things like steroids to reduce inflammation, laxatives for constipation, and analgesics for managing pain, as well as advising you to attempt not to strain while on the toilet and to use simple pads to help with irritation. A seize bath with warm water also helps. If your pile is more cumbersome, doctor can choose to remove or reduce the piles. They can do this in a variety of ways, like banding, which involves placing an elastic band around the base of the hemorrhoid, cutting off the blood flow to the pile. After a few days, it will die and simply fall off. They can inject medications into the pile, causing it to shrink, known as sclerotherapy. Surgery is an option. They can do removal of the pile as like a classical operations, which is called hemorrhoidectomy, or stapler hemorrhoidectomy, wherein a stapler is fired inside the anal canal to cut off the blood supply to the hemorrhoids and reduction of the size of the hemorrhoids. Last is most advanced is the laser treatment for hemorrhoids, which we will be discussing subsequently. Thank you for listening to me patiently for so long. Catch you soon with another important topic. This is Dr. Manas Ranjan Tripathi signing off.